Hello, this is Dr. Wells with Wells Medicine, and today I wanted to talk about the difference between ketamine and TMS. This is a question we get a lot because we offer both of them, but also because the indications for both of them on the surface are the same. So both ketamine and TMS can be used to treat anxiety, depression, OCD, and PTSD. So the overlap is real. But there are some important differences. So, for example, ketamine works on the glutamate system, and it's very globally effective for the brain. So that works very quickly, and it works on neuroplasticity and connectivity, so shifting thought patterns and rumination loops and fight or flight loops. TMS is very local, so when you perform TMS, you'll notice that it is in one very specific area. So, you'll place the paddle and you'll be looking at how the electricity affects or the electromagnet affects one specific area. So it's very local. Ketamine works very quickly. 1 week and 1 day TMS work very quickly, but not as quickly as ketamine. So even the 1 day TMS does take about a week and a half to start seeing the changes. The difference can be that TMS can last a little bit longer than the ketamine. So ketamine generally, even after the first 6 infusions, you're looking at it lasting somewhere between 3 to 5 weeks. Whereas TMS, after the 1 day or the 1 week, usually after that 1 day or 1 week, we can get somewhere between a month to 2 or 3 months. So ketamine's a little faster. TMS it takes a little bit longer to see results, but can have longer lasting results. So those are some of the main differences. TMS you can drive yourself home from. Ketamine you cannot. You always have to have an Uber or a friend or family member drive you home from the ketamine. TMS, you are not sedated. You don't need an IV. There's no consciousness changes, and with ketamine you definitely have an IV or an IM injection, so there is that little bit of discomfort, and you do have we expect you to have some consciousness changes. We're looking for that. We're titrating the medication for that. So we're expecting you to see something, hear something, feel something. So those are some of the big changes or differences that we're looking for between the TMS and the ketamine. So consider in broad patterns, ketamine is very rapid, it's global, and it's a little bit more consciousness shifting, pattern shifting. TMS is more local. It takes a little bit longer, but it can have longer durability, and it's more something you can drive yourself home from, and without sort of those consciousness shifts that ketamine can have. So those are just some things to look for between TMS and ketamine. And if you like this video or the content, please like, subscribe, put some comments, and we look forward to seeing you again later.